The functions and characteristics of TTEP-200 Veterinary Intelligent Vessel Sealing System. The system combines high-frequency electrosurgery with vessel sealing system in one device, tissue feedback technology, and intelligent energy management system to realize the intelligent output of electrocutting and coagulation, and vessel sealing with intelligent output. It has 4 working modes, 11 functions, provides doctors with a precise and safe, efficient and convenient surgical experience. Turn on the power switch on the back of the unit. At this time, the power button on the front panel turns to be blue. Press and hold the power button for 3 seconds. The green light indicates successful switch on. The system has 4 ports for connecting surgical instruments, 2 monopolar, 1 bipolar and 1 large vessel sealing. The 2 monopolar instrument ports have the same function. The purpose is to allow the surgeon before surgery. Before the operation, the doctor can connect the cutting electrode and coagulation electrode to the monopolar port. Cutting electrode and coagulation electrode are connected respectively. The cutting and coagulation operations can be performed freely during the procedure. At the same time, for sudden bleeding during the surgical cutting process, the doctor can use the coagulation electrode to quickly stop bleeding. Reduces the time for the surgeon to pull out the cutting electrode time to replace the electrode with coagulation electrode, by valuable time for the animals to save their lives. Significantly reduce the incidence of medical errors. Next, we will introduce the functions of the system. Cutting mode is divided into 4 functions, namely pure cutting, blend cut 1, blend cut 2, blend cut 3 and intelligent cutting. The main function of the pure cut function is to cut the tissue. The cutting process has a weak coagulation effect. Blend cut 1 function. It is mainly used for cutting procedures with low coagulation requirements. Blend cut 1 function outputs 70% of the energy for cutting, 30% for coagulation. Blend cut 2 function, mainly used for cutting procedures with medium coagulation requirements. 50% of the energy output of the blend cut 2 function is used for cutting, 50% for coagulation. Blend cut 3 function, mainly used for cutting procedures with high coagulation requirements. 30% of the energy output of the mix cut 3 function is used for cutting, 70% for coagulation. Intelligent cutting function is the advanced version of pure cut function. No need for the surgeon to manually set the output power. Intelligent cutting function will be 100 times per second. Tissue status recognition and power adjustment. Dynamically adjust the power output in real time. Ensures optimal cutting results with minimal thermal damage. No need for doctors to set the power manually. Convenient, fast, simple and efficient. Avoid manually setting the pure cutting output power to high, avoiding serious thermal damage caused by manually setting the pure cutting output power to high. The phenomenon of not cutting smoothly due to too low power setting. The coagulation mode is divided into 3 functions. Soft coagulation, spot coagulation and spray coagulation. The soft coagulation function heats up the tissue at a slower rate. Coagulation of tissues that require deep coagulation and stability. Spot coagulation is used for precise coagulation of small areas. Spray coagulation is used for large-scale tissue coagulation. TTEP-200, equipped with advanced return electrode monitoring system. When the negative plate falls off, in case of poor contact and other accidental situations, automatically stop working. Reduce the risk of accidental burns. There are 2 types of bipolar modes, standard mode and macro mode. Standard mode. The host machine follows the power set manually by the doctor. Energy output. Macro mode. The host machine will pass the tissue state recognition technology based on the power set manually by the doctor. Dynamically adjusts energy output by plus or minus 10 W. Further ensures that the coagulation effect is achieved with minimal thermal damage. Coagulation effect with minimal thermal damage. When using the function of large vessel sealing, the host utilizes tissue feedback technology, impedance detection 450,000 times per second, accurately identifies vessel sealing status, improves surgical safety, eliminates the need for the surgeon to determine if closure is complete. When closure is complete, the host will automatically sound a beep and displays a closure completion symbol on the screen. Reminds the surgeon that the vessel has been closed. Pressing the blade trigger completes the severance of the vessel. The power during the large vessel sealing mode. Intelligent real-time dynamic adjustment perfectly adapts to the optimal working power of all types of large vessel sealing devices. Before performing a large vessel sealing, the vessel must be freed from the tissue. Otherwise, the jaws will hold the tissue for closure, will lead to high impedance error of the host computer. The high temperature of the fat in the tissue will reduce the service life of the instrument. The system also offers foot pedal personalization. In addition to using the default settings of the main unit, they can also reset the foot pedals and reset the foot button for different foot activated functions. During the procedure, avoid spilling liquids on the main unit and the foot pedals. Avoid false excitation caused by short-circuiting of the foot pedal, and the system should be used in a non-flammable, explosive gas environment. If anesthetic gas or oxygen leaks, discontinue the use of the system. The system comes with a Type-C interface. Mainly support the technical team to continue to upgrade and iterate. Lifetime free remote upgrades for system optimization guarantee the advanced technology and function of the product. After the operation, long press the power button for 3 seconds to power off the system.